everyone. Welcome to the latest installment of our Paving Pathways Webinar Series. Today's webinar is going to be in partnership with the Hmong Public Health Association. On today's agenda, we have our welcome, our introduction to the speaker, introduction questions, and closing.
Hi, everybody. My name is Brittany, and I am one of the board members and the secretary for North Carolina Hmong Women Association.
And hello, my name is Nathan. I'm a current undergraduate senior at UNC Greensboro, and I am a current public health intern with the NCHWA. So the purpose of this Paving Pathways webinar series is to expose Hmong students in the community to different career opportunities and enrich them by providing valuable resources. And then introducing our webinar speaker, we have Mai, who is an epidemiologist for the Illinois Department of Public Health, as well as the chair of the Hmong Public Health Association. She has a master's degree in maternal and child health, as well as 2 minors, which she graduated with from the University of Minnesota School of Public Health. Would you like to add anything, Mai?
Nope, you got it.
Alrighty. If that's the case, then we will be moving on to the questions for this webinar. So our first question is, what is your job title?
So as the previous slide stated, my name is Mai, and my official title is Healthcare-Associated Infections and Antimicrobial Resistant Epidemiologist.
That's very interesting. On to the next question. A lot of people are unfamiliar with what epidemiology is. Can you define the term in your own words?
Yes. So epidemiology, I feel like it's become a little bit more popular now since COVID-19, but I think to put it in simpler terms, it's the study of disease distribution or patterns, and then investigating determinants of health, such as risk factors, protective factors, um, for health conditions among specific populations, and then taking it a step further and then figuring out what do we do with these findings and how can we use it to prevent or address these health conditions.
All right, that's very nice. Couldn't have explained it better myself. On to the next question we have. What area of epidemiology do you work in, and what are your daily roles/tasks?
So I currently work, again, it's a very, very long term, and so I'll break it down a little bit. As a healthcare associated infections and antimicrobial resistance field. And so it's a really long title, which basically means that I investigate and track infections that are commonly associated with hospital-like settings. And so, for example, that includes hospitals, nursing homes, long-term care facilities, and rehabilitation facilities. The infections that I work with specifically are highly infectious and extremely resistant to antibiotics. In fact, I only work with those that are not responsive to any carbapenems, which is a very strong class of antibiotics. That means that virtually anyone who becomes infected with these organisms usually stays infected, and there is no effective treatment since those patients are usually elderly and also have comorbidities or other illnesses that they've been diagnosed with. And so they often pass away, which is very sad. And so our best route is prevention, right? Since there isn't any active treatment. So some of my daily tasks involve organizing our screening events at facilities who have been identified as high risk for these infections, or we already know that they have patients who have been exposed to previous index cases or positive residents. And so my job as an epidemiologist is to compile the data that we collect from those screening events and analyze it and then report it to our infection preventionists so that they can work with the facility and guide them on, best practices for hand hygiene and making sure that they're keeping up with the correct sanitation and cleaning routines so that they can prevent the spread within their facilities. I'm also the lead for the registry that our state uses to compile these cases. And so I also support technical assistance. And so whenever we have users, such as providers or local health departments who are trying to report these cases and they're having issues with our reporting system, I'll help them troubleshoot and also teach them how to use our database as well. And so, I do educational and training sessions and also speak at conferences about the surveillance in our state, what it looks like, what the trends have been for the last few years, and then also provide resources to providers and local health departments to be better equipped to handle outbreaks within facilities.
That's really interesting. I've also been really interested in antimicrobial resistance because of the nature of the topic, and it's really awesome to see someone who actively works within that whole issue. So on to the next question. Why did you choose to pursue a career as an epidemiologist?
So I feel like I never actively chose to be an epidemiologist. Like I didn't ever go to school thinking like, oh yeah, I want to be an epidemiologist when I grew up. I had always wanted to do something in the healthcare field, and I think traditionally that meant like being a doctor or a nurse. And when I realized that that lifestyle wasn't for me, and I really enjoyed public health, that's when I enrolled in my public health program and discovered epidemiology. And I've said this before in other places and other conversations, but it was really by recommendation of another Hmong student who was in the same MPH program. He was 2 years ahead of me, who told me that one of the essential skills in public health is epidemiology, and that would open up my door more to more opportunities and make me a more competitive candidate. And so I took his word for it. And my major was maternal and child health, but I minored in epidemiology because I knew that I wanted to also be um, in a good place with like quantitative data and qualitative data, because I had a lot of like community engagement experience and things like that, but I didn't have a lot of quantitative data. And so I wanted to be like a well-rounded student and job candidate. And so after I graduated with my master's degree, it was during the height of the pandemic. I graduated in 2020. And this was kind of what was available and was highly sought out after I graduated. And so that's kind of how I, got into being an actual epidemiologist. I completed a 2-year applied epidemiology fellowship with the Council of State and Territorial Epidemiologists, or also known as CSTE. And so I got a lot of hands-on experience as that. And then I just kind of like really enjoyed epidemiology work. It's also one of the positions in public health that does get paid a lot better, especially because we're usually working in like public service, and we know that public service workers don't get paid that much. And so it helps a little bit, right? If you could be in a position where you're compensated a little bit better. And so, yeah, I've really enjoyed my career as an epidemiologist so far, even though it's nothing like what I had planned.
That's really interesting. Like you, I also had a interest in the health of people when I was younger. But doctor or nurse work wasn't really cut out for me. So I actually found out about the field of epidemiology when I was around like middle school or so. I initially wanted to be a vet, but then I'm allergic to animals. So as time went on, I realized that epidemiology would be a better fit for me. And as I've navigated through my undergraduate studies, I've come to really love the field of public health as well. So I look forward to becoming an epidemiologist in the future too. Let's see, on to the next question. What are the educational requirements to become an epidemiologist?
Yes, so a lot of epidemiologists that I've worked with and I know, most of them usually have at least a master's degree. Um, Depending on the type of field you want to go into, there are some people who get like their PhDs in epidemiology. Um, and that's completely fine too, but that's usually more like academia focused. And so it kind of depends on what type of epidemiologist you want to be. And so what I would be called is an applied epidemiologist, which is where I'm actually using like theoretical models and things like that, to influence programming and treatment and things like that. Whereas a lot of folks who go on to pursue like a postdoctorate degree are usually more like going into academia roles and research. And so it kind of depends on like what type of lifestyle you want, I guess, in terms of like, do you want to work at a university or do you want to work for the government? Or do you want to work, at a nonprofit? And so it just kind of depends. That's not to say though that you need an MPH or a master's to become an epidemiologist or to get data experience. It's always more, looks better and makes you more competitive when you also have like previous data experience, whether that's, doing in Excel or Access or things like that. That's also very helpful. And honestly, as an epidemiologist, I use Excel like way more than I even use statistical coding. Um, so, you can always get started and then, move up into more senior epidemiologist roles. It's just kind of the opportunities you get and the teams that you work with.
Great answer. On to the next question. Are there sources you can recommend for Hmong students who want to learn more about this profession?
Yes. So my biggest recommendation is networking. And I think like the platform we're on right now and the space that we're in right now is exactly like where I felt like I had learned the most. Like I said, I pursued epidemiology through recommendation of somebody that I knew, that I had a network with, that I met through, school, and we were also Hmong, and so we had similar experiences. And so I think like the best resource is to leverage your network and to meet those people who you want to um, get into the field, right? So if you are interested about being an epidemiologist, talk to an epidemiologist. And again, like ask a lot of questions. Don't be afraid to ask questions that you think might be stupid or things like, oh, I should already know this. Always ask questions. For me, I try to emphasize more, like I was mentioning earlier, like what do you want your lifestyle to be rather than like what are you really passionate about? Um, because in epidemiology, again, it depends on the lifestyle that you want because you can still be an epidemiologist, but it just depends like where you work, and what type of work that you do. And so my recommendation is to network, get to know people who are in the fields or doing the work that you already want to do and get like the firsthand, advice. And don't just talk to one person, like talk to a lot of people, try to get everybody's opinion. Everyone has different experiences as well. And so, also, take everything with a grain of salt and kind of think about it in your own perspective. Like, how would I feel if I was in this situation, or what choices would I make that best fit my needs? Because what happened for me might not work for your timeline or, what you're going through in your life right now. And so, yeah, just assess things for yourself and talk to people.
Very good. I also think that asking questions is the most important thing that you can do, regardless of the job field that you're trying to get into, because you can learn so much just from asking people, regardless of whether or not the questions you ask might seem stupid or not. Now, on
Mhm.
to the next question. What are important skills to have in your career?
So I will say in epidemiology, the expectation is to have a lot of technical skills. And so when I say technical skills, I mean competency in using Excel and using statistical analysis softwares such as R and Stata and SPSS. A lot of places now are also like they want people who have experience with data visualization. And so those are like software programs such as like Tableau and Power BI and things like that, which are programs that are used to build dashboards, interactive dashboards. So if you've ever gone onto like the CDC website and you see like a map where you can click things, so things like that, products like that. And so I think the most important skills to have for an epidemiologist is the technical skills because that will make you such a competitive candidate and really you can go anywhere with those skills because not only are they used in the public health sector but they're also used um, everywhere else because we're in the age of technology right now. Those skills are wanted everywhere, so if anybody wants to build a dashboard to show how many sales they made for a business or a corporation, you could always bring those skills there too. And I think that's one of the things that I love so much about um, the technical skills as an epidemiologist is that you really can move around into different fields, but like I stay in public health field because I love public health and that's, my vision, my personal mission. And, that's what I do. But really later on, if you changed your mind and you wanted to go like do social media marketing and run numbers and create, interactive things like that, you could do that as well. And so I think one of the most important skills is your technical skills. And so practice, practice, practice. Always make sure that you're keeping up with your technical skills because if you don't use them, you lose them. So,
Good insight. I'm admittedly not the best when it comes to technology, but I do have a bit of experience with like Excel and Google Sheets and um creating formulas and stuff like that, which I do think will come in handy when it comes to the profession. Hopefully I can get better at Excel though, since it seems like I'll need it a lot when it in the epidemiology field
yes.
already. On to the next question. What are the challenges you face in this career and how do you overcome them?
I think so personally in my experience, because I work in the public service sector, so I work for state government. One of the challenges is the bureaucracy, right? And so everything just moves like molasses. It takes years and years before programs get implemented, before funding is finally, dispersed because everything is, funded through grants and federal organizations and things like that. And so I think one of the biggest challenges is just the bureaucracy itself. It just takes forever for anything to happen. And that's one of my biggest frustrations right now is, it's just not moving as fast as I would hope that it would. And how I overcome them is by making the little steps and counting the little wins. I think is important for me to acknowledge, like, okay, we haven't been able to tackle this massive project, but we've been able to connect with this many um, stakeholders or this many community members, and we've been able to make X amount of impact, right? And so it's not just counting like the big wins, but also recognizing that the work that we are doing is making an impact, even though it might not feel like it's a lot or that it's visible. Um, and so, yes.
I can absolutely agree with the point that everything moves like molasses when it comes to the US bureaucracy, because I know that my mom, she works in the healthcare field and is also a government worker for
Mhm.
the VA hospital. And she always mentions how everything moves so slowly in government and how it takes forever to get things done. So yeah, I definitely agree with that point. On
Mhm.
to the next few questions, which are about Hmong identity now. Can you tell us more about your position and role at the Hmong Public Health Association?
Yes. So let me tell you a little bit about what the Hmong Public Association is first, so you can understand my role a little bit better. So the Hmong Public Health Association is a small, very new grassroots organization. We started in about winter of 2020, so it's been, oh gosh, almost going on 4 years now. I didn't even realize that. So we're not as new. It seems like we're still really new. But we started off as just like a group of friends from, public health school. And we're like, why don't we just make this into a more official thing? We could help so many more people. We could apply for grants. We could do projects together that would benefit our community and other Hmong public health professionals, right? And so we made it official. And now we have about 60 members across the US that are professionals and students. Um, and it's been really great. Like I've loved meeting so many, Hmong folks in the Hmong public health field, and it's like I love public health, but when I'm with Hmong public health people, it just feels so much better. And so I'm the chair of the Hmong Public Health Association. And what that means is because of how small we are, that means that I'm involved in every single aspect of the Hmong Public Health Association. So that's applying for grants, that's programming, that's our advocacy and policy work, that is engaging with members, that is event planning, everything, right? Financial, fiscal sponsorship, things like that. And so I really oversee all operations at the Hmong Public Health Association, and I work with a pretty close knit small number of my executive leadership who are super strong, like great public health role models that I honestly could not have like even dreamed of, running an organization if I didn't have, my executive team with me. And so, yeah, very thankful for them.
Yeah, honestly, 2020 seems it feels like it was just like a year ago. Time has gone by so fast,
Hmm.
but it's really good to see that your organization has still been thriving for the 4 years that it's been established. On to the next question. How does your role as chair of the Hmong Public Health Association and your job as an epidemiologist impact Hmong in your state? What about the impact on the Hmong community in the US?
So I'm originally from Minnesota, but I have moved quite a bit in the last 4 years. I spent about 2 years in New York during my fellowship, and then I just moved to Chicago last summer. And so I haven't been able to engage with the Hmong communities in a public health capacity in New York or Illinois now. But a lot of the work that I have done as a HPHA chair and also sometimes with my epi hat on is has been in the state of Minnesota, since that's where a majority of our membership base is. That's where the rest of our executive leadership team is, aside from me, kind of the only odd one out. And so a lot of the work and the impact that we have had on the Hmong community has been in the state of Minnesota. And so I think one of the unique perspectives that I bring to HPHA as the chair and also as the epidemiologist is being able to understand the data side of public health and understand kind of what the barriers are, what are the ways that we can advocate for our community, what are things that are realistic to ask for that I know that we can do as someone who's kind of been on both sides. Um, And so a lot of times, like even in my job, when it's Monday through Friday, my 9 to 5, I still have my nonprofit hat on as a community member. I always think like, okay, if I was the community member in this situation, how would I want me to respond? And so I always act with that hat on. And then I always think, when I'm requesting things as a community member from the state or the local health department or their government, what kind of things are realistic to ask for, and are fair to ask for, and do I have the right to ask for, right? And so, for example, in 2021, the Hmong Public Health Association, we released a article in collaboration with the Coalition of Asian American Leadership, which is a nonprofit organization based in Minnesota, outlining the COVID-19 mortality in the Hmong Minnesota community, along with the Karen and Karenni community. And so I was able to kind of bring the data lens on that and be able to interpret the data and be like, okay, this is what it means for us, because when we look at large race data groups, and if you don't know, you don't know, right? You just take it at face value and you trust that whoever's sharing that information with you is doing it, that's the best of their ability. And so when we look at the data, there were about 5% of Asian Americans that live in the US. And when you looked at COVID mortality, the death rate was about 6%. And so when you think about that, you're like, oh, it's not that bad, like we're experiencing the burden of, COVID-19 mortality about just as much as we should be, right? But then when you actually disaggregate the data and you break it down into the specific cultural subgroups of like Hmong, Vietnamese, Chinese, Japanese, the picture is a little bit different. But you have to understand that, right? That it means different things when you're looking at different numbers and different populations. And so the numbers for the Hmong community was that we made up 30% of the Asian American population in Minnesota, but we accounted for almost 50% of the deaths in the Asian American population, right? And so that's what we would call an overrepresentation. We are experiencing an excess of mortality that we should be, right? If we were receiving the same treatment, if we had the same social determinants of health, we would have been experiencing similar to what our population number was, which was around 30%. And so again, it takes that data background to understand and break down these numbers and explain to the community, this is why it's important. This is what these numbers mean. And this is what we can do to make sure that, one, we are represented in the data, and two, like what you can do to do your part as a community member or as a health professional or, as anyone, right, who wants to, move the needle towards data equity and health equity for our community. And so I think, in short, I know that was a long answer, but I think that's like one of the unique, experiences that I bring as somebody who understands data and also passionate about like, health equity in the Hmong community. And that
Yeah.
has, just the second part of how it's kind of impacted the US. So we have members across the US, and a lot of them work at state health departments. And some of them work with states that have large Hmong populations. And so I've been in conversation with some of my peers of how they could replicate the work that we're doing in their states for their Hmong communities. And so I think this is definitely like spreading. The work that we've done is definitely spreading to other states, not just at like a local level, but at a state level. Because in Minnesota, we were able to make changes to have the state health department create a standardized demographic data collection standard. And then we went and we presented that at the American Public Health Association, which is the largest public health meeting in the US. And so, we've done a lot of great things, and I'm hoping that, our members get the inspiration to do that for their own states and their own communities.
Yeah, honestly, I hadn't even heard about this COVID-19 mortality disparity in the Hmong until now, but it really highlights the importance of disaggregated data and having specific data specific to the Hmong community. I know that here in North Carolina, there isn't a whole lot of specific data, as in a lot of data sources actually leave out Asian American as a category altogether, much less Hmong.
Mm-hmm.
So it's really important that we have that disaggregated data so that we can see if there are disparities in the populations that we serve. Really important. On to the next question. As a Hmong woman working in the public health field, what public health issues do you think need to be addressed the most in the Hmong community?
I feel like this is one of like the hardest, because there's like so many things, right? That that I've seen anecdotally, like I've, personally experienced or seen firsthand in the community. I think the first thing that comes to mind, as a public health issue that I think is a priority to be addressed is mental health. I think mental health is kind of the umbrella that, looms over all of the other issues that we see in the Hmong community, right? When we are seeing like domestic violence, when we're seeing chronic health conditions, when we're seeing COVID-19 that's, not being able to be addressed, when we're seeing, other health issues that are common in the Hmong community, we can all kind of tie it back to our historical experiences and traumas, and mental health, right? And I think mental health is something that people have been talking about for a while now. It's been a pretty popular topic, but what does that mean in the Hmong community, and what are we doing to address it on a large scale? And I'm not talking about just for like women, because I think a lot of times we only talk about women's mental health, but it's also like, men's mental health and boys' mental health, and giving everyone kind of the space that they need to talk about these issues, and seeking professional help. Like I tell everybody all the time, like when I'm rich, everybody's going to know, because everybody's going to have a therapist, and we're all gonna get professional help together, right? And so I think, yeah, mental health is something that I think definitely is at the core of a lot of the issues that we see in the Hmong community. And we can treat the symptoms, right, which are all of these other issues. But if we're not treating the core, we're not getting anywhere. We're maybe helping one case, but we're not getting to the actual root of the problem. So I think mental health is definitely one of the priorities that I see as a public health issue.
Yeah, mental health is definitely a huge issue. When it comes to the counties that I've researched in North Carolina that am home to Hmong, mainly Catawba and Burke, what I've noticed is that both of these communities in their health needs assessments, they've labeled mental health as a priority need when it comes to these pop to the populations that live in these counties. I've also noticed
Mhm.
that the Hmong tend to experience significant disparities when it comes to mental health. So, like for example, I found an article recently that's found that 73% of Hmong elders surveyed experienced some kind of depressive symptoms, which I think was
Mhm.
a really alarming statistic to say the least.
Mhm. And I think to add on to that too is the lack of translation or accurate explanation of what mental health is. Because in the Hmong community, when people talk about mental health, they talk about like the term that's commonly used is crazy, right? You're just crazy. And I think that's creates such a negative connotation about talking about mental health, that people don't understand. They think when they hear mental health, they think, oh, that doesn't apply to me. I'm not crazy. I'm fine. I have a working job. I pay my bills. Everything's fine, right? And so I think it's just, and not even like in the Hmong community, I think in the general community, there's a lack of understanding of what mental health means and mental health like acceptance. And so, yeah, there's a lot of multifaceted, complex, issues that all contribute to, our poor health.
Yeah, I know the stigmatization of mental health is a huge issue, not exclusive to the Hmong community, but in Asian communities in general, such to the point that like when it comes to help-seeking behaviors in Asians are the
Yeah.
least likely race to seek help for mental health, and they often do it when their mental health has deteriorated so much that like they experience severe symptoms of mental health disorders. Mhm. So on to the next question now. This is the last question, I believe. If you could give advice to your younger self and young Hmong girls, what would it be?
Um, my advice to my younger self and to other young Hmong girls who were like me is to believe in yourself. I think there were so many moments in like my academic educational career and my professional career that like I doubted myself. And I feel like I'm still working through this now. I haven't completely gotten, over it yet. I'm not 100% there yet, but what I have learned is to believe in yourself. Like if that's truly what you want to do and you believe that you can get there, then go for it. No dream is too high. Because I have young girls or people who are in college and they're like, oh, like you're exactly where I want to be. And sometimes we don't realize that we're living now where we wanted to be like 10 years ago. So I have to remind myself that and then also be able to reflect and be like, if I could get here, you can get here too. Like the dream isn't that far away. And people who care for you won't won't care. Like they'll support you with whatever you want to do. And so I guess my second piece of advice is choose people who choose you. I think one of the reasons why I'm able to be where I am today is through like the unconditional support of my friends and my family and my partner. And so one, believe in yourself, and two, choose people who choose you.
Yeah, I agree with the advice that believing in yourself is one of the best things that you can do because if you have that confidence in yourself to keep moving forward, then you can strive to reach what you want to do.
Mhm,
You can't reach what you want to do if you never try to do it and don't believe
mhm,
in yourself.
mhm,
Alrighty. So thank you to everyone who stayed until the end of the webinar, and a special thank you to Mai for taking her time to come and speak and answer all of the questions on the webinar today. You can find us at the links on this slide.
Yes, and thank you so much for joining us, Mai. I also am a member of the Hmong Public Health Association, and I can attest that whenever I do join the meetings, Mai and the board makes it so welcoming and so supportive, where we can sort of just pour out like our ideas and experiences, and it's really nice. So if you are a public health professional or student, I highly recommend you joining us. Um, And you can find, I will also link the links in our YouTube description where you can find that as well. Alrighty, well,
And
thank you.
before we close, I also want to say thank you to both of you for inviting me to be part of this experience. And then highlighting, the Hmong Public Health Association, right? It's like other Hmong people and other like women, I feel like who have uplifted me. And so thank you for inviting me and thinking about me. And I look forward to future partnerships and networks that we can, share with each other.
Yes, I definitely will be reaching out. Thank you so much. Everyone have a great night.